Good evening, students. Today I want to talk to you about prostate gland. I've already fixed, a small video of the prostate gland. Prostate gland is about the size of a walnut. It lies at the base of the urinary bladder. There is a bladder neck and there is an internal sphincter, which is a specialized muscle which causes sphincter to open and contract also. So this internal sphincter is important because when there is, it prevents during sexual intercourse and whatever it is, it prevents retrograde ejaculation of the semen into the bladder. That is one of the functions. Okay, and if this sphincter is distorted for any reason, say like during surgery or transurethral resection of the prostate, if it is damaged, there is a possibility of retrograde ejaculation of the semen into the bladder. And if the internal sphincter is already gone as during surgery, and God forbid during transurethral resection of the prostate, if the external sphincter is damaged, there is no cure for it, and the patient will have dribbling of the urine or the incontinence throughout his life. And the treatment for surgical treatment for this is not yet evolved. So the prostate gland starts as a branching of the epithelial buds, which are solid and which gets canalized in the intrauterine life. And it is after many weeks, and after that it develops into a gland proper through the surrounding mesenchymal tissue, the muscular tissue, and the connective tissue. Okay, McNeil has, we have a newer classification of the anatomy of the prostate gland. One part is periurethral. You have already seen that prostatic urethra is surrounded by prostate gland. And prostatic urethra is the widest part of the male urethra. It is somewhere around 11 mm wide. It has got a verumontanum. It has got a prostatic utricle. It has got openings of the prostatic glands on both sides in the posterolateral groove. All right. So there is a periurethral transition zone. As far as prostate's anatomy goes, there are three zones that are very important. One is periurethral transition zone. This is the zone from which the benign hyperplasia of the prostate occurs. As I've already told you in my this video, that it is the enlargement of the periurethral transition zone which pushes the posterior part of the gland. The posterior part of the gland, the peripheral zone we call it, into the periphery, and this becomes the false capsule. Now this part of the prostate gland, which lies below the ejaculatory duct, which passes through the prostate gland, is called the peripheral zone, which is most common site for carcinoma of the prostate. And above the ejaculatory duct, what you find is the central zone. Central zone too lies posterior to the prostate urethra, and at the bladder neck there we have got internal sphincter. And a situation may arise, that central zone, when it is enlarging, it may push up the prostate tissue through the internal sphincter, and this is called the middle lobe. Sometimes the enlargement of the prostate from the lateral lobes, they also push itself through the internal sphincter into the bladder. So therefore there is some kind of a post prostatic pouch in which there may be the stasis of the urine, and there is obstruction to the outflow of urine from the bladder. One of the reasons for bladder outlet obstruction, that is prostatic enlargement of the prostate. So I'll repeat again, we have a periurethral transition zone, we have got a peripheral zone below the ejaculatory ducts, and we have got a central zone. All right. And there are various types of glands which you have already seen: the mucous glands, the adenomatous glands, and the branched glands also, which open on both sides of the this thing what you call prostatic urethra in the posterolateral grooves on both sides of the prostatic utricle and virumondin. Now coming to, let us see, we study the hormonal aspect of the prostate gland. The hormonal aspect of the prostate gland is that it is dependent upon the male hormone, that is testosterone. Testosterone is converted into 1,5-dihydrotestosterone. Testosterone is a male hormone which is secreted in 90% of the cases from the Leydig cells of the testes. The Leydig cells, Leydig, Leydig cells of the testes secrete testosterone, which is a male hormone. As a 5 to 10% of the testosterone, the male hormone, is secreted by the adrenal cortex. Now, this secretion of the testosterone is dependent upon the secretion of the luteinizing hormone, which is secreted from the anterior pituitary. We have got anterior pituitary, okay? It secretes luteinizing hormone, which stimulates the secretion of testosterone. All right. Now, the luteinizing hormone itself is dependent upon its secretion on the luteinizing hormone releasing hormone, LHRH, okay, which is secreted by the hypothalamus. And this luteinizing hormone releasing hormone is secreted in a pulsatile manner. It is not that it is constantly secreting the luteinizing hormone releasing hormone. No, it is secreted in a pulsatile manner, and it affects the pituitary, the anterior pituitary, which secretes the luteinizing hormone, which in turn stimulates the Leydig cells in the testosterone to secrete testosterone. All right. Now, this fact is made use of in the treatment of carcinoma of the prostate when you would like to block the secretion of luteinizing hormone releasing hormones by exhibiting luteinizing hormone releasing hormone analogs. Now, this testosterone is converted into 1,5-dihydrotestosterone. What is it converted into? The testosterone secreted by the Leydig cells of the testes gets converted into 1,5-dihydrotestosterone by an enzyme excretion which is called 5-alpha reductase. What is it called? 5-alpha reductase converts testosterone into 1,5-dihydrotestosterone, which is 5 times more active than the testosterone. Now, this testosterone acts upon the prostatic tissue, and you see this hormone 1,5-dihydrotestosterone is much more in volume, you can say, in the prostate tissue and perigenital area also. So is this 5-alpha reductase also. Then I like to say is that there are certain peptides like insulin-like growth factor, epidermal growth factor. Then comes your this thing what you call transforming growth factor alpha and beta, and fibroblast growth factor, which are responsible somehow for enlargement of the prostate. The prostate gland, as a person advances age, say after 50 years, the prostate starts enlarging in all patients. And whether it has got a more of a fibrous tissue or it's more of a muscular tissue, after all, the prostate glands, they have glandular tissue, they have got a muscular tissue, they have got a mesenchymal tissue. All right, there's a gland. It's something like in female, in the breast they have epitheliosis, adenosis, and mesenchymal tissue or connective tissue or something like that. So therefore, in prostate gland proper, with the age, with increase, the person when he's aging, what happens is that the prostate starts enlarging. There is, some kind of a diminution in the secretions of the testosterone, but however, the estrogenic steroids in males even, which are secreted by the adrenal cortex, they remain unchecked, and therefore these estrogenic steroids do affect the secretion of luteinizing releasing hormone in the hypothalamus. It is not, it diminishes its secretion, The luteinizing hormone releasing hormone is also, somehow you can say desensitized, in the sense it is not secreted in that volume as it was during younger days, and so therefore the testosterone secretion comes down because of estrogenic steroids. And one of the reasons of prostatic enlargement is this estrogenic steroids. Now, the enlargement of the prostate, as I've already told you, there is involvement of the glandular involvement, the mesenchymal tissue, and when it starts increasing in size, the periurethral transition zone compresses the peripheral zone outwards, having a fibrous capsule. The peripheral zone is pushed by periurethral transition zone because of the enlargement, because of the age factors, and it makes at periphery a fibrous capsule, false capsule. And outside this false capsule is a true anatomical capsule, which again a fibrous tissue, and there is a condensation of endopelvic fascia or the prostatic sheath, which posteriorly behind the prostate gets merged with the Denon-Weiler's fascia. So this is Denon-Weiler's fascia is a kind of a wall between the prostate gland and the rectum. So therefore, when the prostate gland enlarges, it may cause bladder outlet obstruction. When there is a bladder outlet obstruction, the patient, may get symptoms of what you call LUTS, lower urinary tract symptoms. What we say? Lower urinary tract symptoms, which means there are some specific symptoms in a person who has got prostatic enlargement. All these lower urinary tract symptoms may not be due to prostatic enlargement. There may be other things. Before you do the surgery on a patient with sign and symptoms which feels it's because of bladder outlet obstruction and prostatic enlargement, he may be having something else. There may be weak detrusor muscle. It is not contracting so forcefully to push the urine out. There is a stasis of the urine, and urine comes out in small jerks, little bit. There may be incontinence. The person may be having some kind of a neurovesical problem. There will be something wrong with the nerves. There may be some kind of a involvement of the nerves. So, or person may be having diabetic neuropathy. There may be some kind of a Alzheimer's disease, and there may be degeneration of the muscles of the bladder wall. So we jump to the conclusion that elderly patients' problems are due to prostatic enlargement. It may not be so. You better check up, because if you do prostatectomy in a person who has got problems somewhere else, there may be neurogenic problem, there may be problem with the detrusor, and you are operated, the patient will not get the relief. The problem of lower urinary tract symptoms will continue to remain there, then he will be, it's very difficult to explain. So be very careful when you're doing the surgery, and absolutely you should confirm, establish beyond doubt that whatever bladder outlet obstruction or its symptom or sequelae is, it is just because of the prostatic enlargement. So he may benefit by surgery. Anyway, now what happens when there is a bladder outlet obstruction? The patient has got large amount of residual urine. The urinary bladder muscle, that may get hypertrophied. Once it gets hypertrophied, the muscle bundles become very prominent. This is called, when the muscle bundles within the urinary bladder, because of bladder outlet obstruction, becomes prominent. This is called trabeculation. What is it called? It's called trabeculation. And in this, the bladders, these muscle bundles, they make small kind of sacs, which is called sacculation. And sacculation is a weak part in the urinary bladder with bladder outlet obstruction. So here the mucosa protrudes out diverticulum. Diverticulum is something going haywire besides normal, something looking beyond. Like I am talking to you and I start looking this way. So this is a kind of a diversion, diverticulum. So one of the complications of bladder outlet obstruction is trabeculation, sacculation, sacs are formed. There are small depressions within the wall, depression. Bladder is distended, muscle bundles are, hypertrophied, and So this hypertrophy forces the mucosa to protrude. It makes small sacs, depression, which is called sacules, and through this sacule, the mucosa protrudes out. It goes out. It's called diverticula. And there might be, bladder outlet obstruction may also be due to increased tone of the internal sphincter. So, if a person is having urinary problem, an elderly person, because of prostatic enlargement, he will have some kind of symptoms which we called as lower urinary tract symptoms. In such a situation, the prostatic urethra becomes lengthened. There is increased curvature of the prostatic urethra. And if one lobe of the prostate is enlarged and the other one is not enlarged to, comparatively it's not enlarged to that extent as its other part, so there will be what you call distortion of the urethra. You see that? And enlargement of the prostate, we'll discuss later on during diagnosis. How do we establish the diagnosis? Is through the digital rectal examination, which I'll talk to you later on. But today I would like to finish short. Now next is clinical features. What happens to a person who has got benign enlargement of the prostate? As I've already told you, that person after 50 years they start having prostatic enlargement, hypertrophy of the prostate. The muscles enlarge, the glandular tissue may enlarge, become voluminous, or there may be fibrous tissue also, increase in fibrous tissue. So therefore the consistency will be a little different. But still it may cause bladder outlet obstruction because of the enlargement of the prostate gland. And what happens is that person is going to have symptoms because of two things. Two factors are in. Patient is not able to evacuate his bladder completely. A large amount of urine is stored in the bladder. Sometimes the chronic retention, even 1 liter of urine is there. And patient is happy, he doesn't realize that he has got chronic retention of the urine. If there is acute retention of the urine for the first time, there is a palpable, tender urinary bladder one can feel, and patient has got an intense desire to pass urine. He has got a pain. The acute retention of the urine, with sudden stoppage of urinary outflow. But in chronic retention, because of gradual increase in size of the prostate for a prolonged period, for months and years together, a person may have 1000 ml of urine in the bladder and he does not realize that his bladder is distended, which is source of infection and stone formation, stasis of the urine. Patient may have diverticula. Diverticula may have infection and the stones because of stasis, because of stagnation. So what I mean to say is, the symptomatology will depend due to storage. That means there is a large amount of urine which is accumulated, and it will cause the problems, the symptoms. And the other factor which can cause these urinary symptoms, lower urinary tract symptoms, is the symptoms of voiding, that when he is passing urine he feels those problems. So what are the symptoms? Number one, the person who has got prostatic enlargement as such will never be satisfied. He goes to the washroom, he comes back and he is still not satisfied, he wants to go again. These are called bothersome symptoms. What are these called? Bothersome symptoms. A person who is an executive, is attending a meeting, is presiding over some function, every 5 or 10 minutes he starts going to the washroom, he's got an intense desire to pass urine. These are called bothersome symptoms. He requires some kind of a treatment for this, which we will discuss later. So therefore a person, a person who has got prostatic enlargement, one of the reasons for for incomplete voiding of the urine and desire to pass urine, this becomes part of what you call problem of storage. Then comes, as a person who has got prostatic enlargement, his urinary stream is thin, poor. There may be multiple streams also. Alright. And he may have hesitancy. Hesitancy means person goes to pass urine. He wants to pass urine, but he is not able to initiate the act of micturition or urination. He has to wait for some time. This is called hesitancy. Bladder is full. And besides that, what happens is his bladder is full, he coughs a little bit of urine comes out. That may be dribbling of the urine. It's a very, very uncomfortable thing, and it is a social kind of a problem. A person would like to cut off his social activities because of this. And then, he has got features of retention. If it is already not a chronic retention, prostatic enlargement suddenly when a person is exposed to cold, he had a bout of alcohol and taken excess amounts of alcohol in a cold winter night, there may be acute retention. Now let's come back to this thing. The symptoms which are pertaining to voiding. In voiding, what happens is that person wants to go to the toilet again and again. His frequency of passage of urine during daytime and night increases. He may go and pass urine at night. Nocturia, he's going to the toilet every 2 or 3 hours. So one should think in mind that this may be due to prostatic enlargement. And a person with prostatic enlargement, he has got urgency. He has to run to the washroom to pass. Otherwise, he feels that he will void urine in his trousers or clothing, whatever it is. So this is called urgency. He must go. He is in a great hurry. And then what you call is there is a urgent continence. Urgent continence. He wants to pass urine and his urine is dribbling and he passes urine in his clothes. Besides that, there is, you must have seen the small children sometimes they wet their clothes, so the poor bladder training, that is issue altogether different. But what I mean to say, the nocturnal incontinence and a kind of a thing which he may pass urine while in sleep a little bit or whatever it is, it depends on the relaxation. So this is all I wanted to speak to you today, and then next I would be talking to you about a little bit of other features of bladder outlet obstruction besides the prostate gland, investigations, management, and then if you want to let me know, I'd like to cover very important topic, that is prostatic carcinoma. So in brief, I would like to say is that prostatic enlargement is a common feature related to advancing age. And another thing which I want to tell you, the most important aspect which is linked with this is the prostate specific antigen we call PSA. PSA, the normal level of prostate specific antigen is seen. It is a glycoprotein. It is a glycoprotein. And this prostate specific antigen you find is around the prostate gland itself, perigenital tissue. And it should not be more than 4 nanogram per ml. What did I say? The prostatic value should not be more than 4 nanogram per ml. But prostate specific antigen increases with the advancing age, number 1. Benign prostatic hyperplasia, enlargement of the prostate, and prostatic cancer. It is a tumor marker. What I said, it is a tumor marker. Prostate specific antigen is a tumor marker. That means it indicates whether a person is having some kind of a problem. Now a person who has got an elevated prostate specific antigen, say 30 nanogram per ml, it is far, far higher and beyond than the normal levels. So therefore there is a very strong suspicion clinically that a person with 13 nanogram per ml of prostate specific antigen is having carcinoma of the prostate, not only maybe advanced, but it has gone beyond into the bones also. It has spread outside, metastatic carcinoma of the prostate. And in this situation, the prostate specific antigen will be increased. Alright. But as I have already told you, PSA is not specific or sensitive. That person who has got elevated levels of prostate specific antigen is having cancer. A person whose prostate specific antigen is elevated, it is not necessary that he is having cancer. In 25% of the cases, in 25% of the cases. When the PSA level may increase 10 to 15 nanogram per ml, only 25% of the persons you have prostate cancer. All right. And at times what happens is in 15% of the persons whose prostate specific antigen is just not more than 3 to 4 nanogram per ml, they have prostate cancer. So this means it is neither specific or not sensitive. Sensitive means a person is having, say we take this thing 100 cases. So we can say we measure this prostate specific antigen, and out of 100 we find that 98 are having this thing elevated prostate specific antigen, which doesn't happen. So it may be a person having true negative, which tells you that no, we have assessed it and it is not there. This becomes specific. But if it says it is there, it is positive, that becomes sensitive. So therefore, as I've already told you, it is not a must that prostate specific antigen is increased and he has got prostate cancer. No, not possible. It's not true totally. So therefore, it is neither sensitive nor specific. However, there is a strong suspicion whenever it is highly elevated, like 30 nanogram per ml or so. There are other causes of increase in prostate specific antigen, like the age factor is there, like prostate enlargement is there, the prostate cancer is there, and even I can tell you this much: we have seen cases where a person has got genitourinary tuberculosis. The prostate specific antigen is markedly increased and putting great anxiety on a person in old age. So what I mean to say, this prostate specific antigen is probably its job may be somehow to what you call is liquefaction of this semen. All right, and this is done by immunoassay. And next time, with these words, I finish my talk, and I'm going to talk to you about investigations and various modalities of treatment of enlarged prostate. Who are the persons who should not be offered surgery, who has got lower urinary tract symptoms? Who are the persons who will benefit by medical treatment, that he need not undergo surgery? So what are those factors? What are those investigations? What are the clinical parameters we're going to discuss in next part? Okay. With these words, I thank you very much, and I hope you find my talk useful. If you find there is something wrong, you want that something else can be done, please do let me know. We are always open and to discussion, and always open to your suggestions. So kindly, a person who is talking, there are always better people to speak, there are better way of talking. So, and there are still suggestions which should be most welcome, which can help us improve ourselves. And I can tell you this much: students are the best judge of a teacher. Thank you very much, and God bless us all.